Welcome to Maine Concerns, where our news team gives you a closer look at the events that happened around Maine this week.
Good morning. Thanks for joining us. I'm your host, Cindy Campbell. Today we're going to tell you about the way a summer camp for children and adults with disabilities is adapting their programs due to the pandemic. But first, May is National Lyme Disease Awareness Month, so I talked with Dr. Kristopher O'Connell of Northern Light Health about the symptoms and effects of Lyme disease and how to prevent getting infected. So we're talking about Lyme disease, and we'll get into symptoms in a minute, but can you just give me a general description of what is Lyme disease?
Sure. Yeah, Lyme disease gets its name from a small town in Lyme, Connecticut, hence Lyme disease. And in this town, they started noticing that children were getting an increased amount of joint pain and arthritis. They found out that this was coming from a tick-borne illness. Lyme disease is the most common vector-borne disease that we have in the United States, and we estimate around 300,000 cases per year. It's mostly caused by a bacteria called Borrelia burgdorferi, and it's transmitted to humans through the bite of an infected deer tick. It can cause a variety of symptoms if not identified and if it's left untreated.
Yeah. And that's the only way to get it, right? Is through the bite of a deer tick.
That's correct, yeah. There's no other way to get this other than through a tick. It has to be a certain type of tick as well. It has to be attached over 36 hours, and it's a little gross to think about, but the tick actually has to feed on you and then regurgitate because the saliva is what really carries the bacteria. So this whole process usually takes at least 36 hours to happen.
And that's an important point. It has to be on 36 hours. So if you have a tick that is just burrowed into you, you don't have Lyme disease at that point.
Correct. It's very unlikely, especially if it's under 24 hours, it's very unlikely that any transmission has occurred at that point. You can still have breakage of the skin. You can still have a retained tick, and other problems can come from that, but it's very unlikely that Borrelia burgdorferi bacteria is transmitted.
Okay. So what are the early symptoms of Lyme disease? What should we watch out for?
So Lyme disease makes you feel at first like you have the flu. It can cause a rash, fever, body aches, and joint problems. A rash can develop where you were bitten. The rash often appears within 3 days to a month, and it can occur where the tick bite was. It can be red, but the center of it can be the color of your skin. And it might get bigger over a few days, and to some looks like a bullseye. You'll hear the bullseye rash described a lot with this.
Right.
The rash can then move and show up on other parts of your body as well. You can also develop heart problems from this, such as a slowed heart rate. Neurologic symptoms can develop as well, including a headache and stiff neck with things like meningitis. You can also have a facial drooping and trouble closing one or both of your eyelids, as in Bell's palsy. Wow. So those are typically the early symptoms of Lyme disease.
Wow, that's a lot. And you don't necessarily have to have the bullseye rash, correct?
That's correct. Some people don't have these flu-like symptoms. Some people don't have the rash. Sometimes they develop symptoms months later. So it can be a hard disease to diagnose.
And at what point do you seek medical help?
Well, it's important to seek medical attention if you develop any of these symptoms, but it's hard to know, should I go to the office or not? So usually calling your doctor's office, talking with a triage nurse can be beneficial. They can help you determine if you need to be seen or not. If the tick was removed sooner than 36 hours, it's very rare and unusual to develop these symptoms. But if you have, these flu-like symptoms and they're lasting 1 to 2 weeks, you should especially be seen.
Okay. Is Lyme disease contagious?
Well, the tick gets this bacteria usually from mice. Everyone says it's a deer tick, so it's from the deer, but it's usually the mice that have the bacteria, and the ticks are usually using the deer as a food source. But as a person to person, no, you can't transmit this bacteria. It can't be transmitted from touching, kissing. It can't be sexually transmitted, and it can't be transmitted from a mom to a baby when she's pregnant either.
Okay. All right. That's good to know. Is Lyme disease curable?
Yes. Lyme disease is usually treated with antibiotics. There's a few different types you can use, but we usually use doxycycline unless there's a contraindication. The treatment's usually 4 weeks duration. Sometimes these symptoms improve quickly. Other times it can take weeks or months for the symptoms to go away.
All right. Is there a window for treatment? I mean, is there a point where you were bit, you didn't realize you were bit, and it's been too long to get that treatment?
There isn't really a window for treatment. Because like we said, sometimes these symptoms develop months later than the tick bite. There is a window for something called prophylactic therapy. This is usually a one-time higher dose of doxycycline. This can help prevent the transmission of the disease and dissemination of the disease. You have to meet a couple criteria for that. The tick has to first be identified as an engorged deer tick. It has to be attached for at least 24 hours or unknown. The patient also has to reside in an area where the prevalence of Lyme disease in ticks is greater than 20%. So if you live in Maine, we know it's higher than that. It's around 40% in Maine. The prophylaxis, the therapy that you get, has to be started within 72 hours of the tick removal, so that would be your window. And you have to be able to tolerate the medication doxycycline.
Okay. So if you're bit by a tick, you get Lyme disease, you don't realize you have it, you don't get treatment. What kind of long-term effects are you looking at?
Yeah, there are some long-term effects if you're not treated quickly. This is sometimes called late Lyme disease. Some people develop late Lyme disease without having any earlier symptoms. Most common symptoms of late Lyme disease include swelling of the joints, like your knees. But some people can even develop trouble with their memory or cognition or thought process. But usually the late symptoms have to do with joint pain and swelling.
Okay. That's an awful lot coming from a tiny little tick.
Yeah, it is, unfortunately.
And there are so many of them in Maine. We're already pulling them off our dog and off ourselves. So daily tick checks are important, I would think.
Yes, if you're looking at ways to prevent this, it's really about avoiding ticks or decreasing the habitat of ticks. Or if you do get exposed, removing them quickly. So ways you can do that, you can avoid things like tall grass and shrubs. And, ticks can't really fly or jump. A lot of people say that, but it's usually passed from walking by either your animal or yourself. So you can try to use insect repellents and applying pesticides as well to reduce the tick habitat. There are a couple of tips you want to use if you know you're going to be in a place that is a high prevalence of ticks, like in the long grass shrubs, if you're hiking, things like that, where you'd want to wear shoes, long sleeve shirts, long pants if you're going outside. You can even tuck your pants into your socks to prevent any skin exposure. You want to wear light colored clothes so you can spot any ticks that may be on your clothes quickly. Bug repellents can be beneficial, especially sprays or creams containing DEET. You shouldn't use DEET on babies younger than 2 months, and we recommend using no more than 30% DEET on young children. You can also use something called permethrin as well. After being outside, you'd want to shower within 2 hours. We know these ticks, they can't live in soil, they can't live in water, so that's a good way to kind of prevent that. You can put your dry clothes briefly into a dryer for about 4 minutes to increase the temperature. That can help. But you want to check your clothes, your body for ticks after being outdoors. You want to check everywhere, including your scalp, your waist, your armpits, groin, and even the back of your knees. And maybe make sure you check your children as well. We know that deer and mice carry ticks, so if you're in a place that has deer and mice, you might want to take some steps to limit that as well.
Yeah, I live in the woods, so I understand that.
So you're high risk.
Yeah, exactly. I live in the woods with a dog, so yeah, exactly.
Yep.
If you've had Lyme disease and you've been treated for it, can you get it again?
Unfortunately, yes. You can get infected again if exposed to another tick carrying the bacteria. It's a little bit more complicated to diagnose because we use something called immunoglobulin levels, and after being exposed in the past, these can already be positive. So it makes testing a little bit more difficult. There's also something that's a little bit more debatable in the medical community called chronic Lyme disease or post-treatment Lyme disease syndrome, where someone has symptoms lasting after treatment, including pain, fatigue, muscle issues, and they can also have flu-like symptoms. These symptoms usually are lasting more than 6 months to kind of get into this category. The exact cause isn't really known at this point, but most medical experts believe that it's lingering symptoms as a result of residual damage to tissues and the immune system that occurred during the infection. But again, it's something that's being studied currently that we don't know a lot about.
All right. So finally, where can folks get more information? Is there a website, Dr. O'Connell, where they can get information?
Yeah, what I tell my patients is to really avoid the .coms, when you're looking for information. I recommend cdc.gov or maine.gov. If you stick with the .gov, the .edus, they tend to have more reliable information.
Find more information on the Maine CDC website.